Bonjour tout le monde. Hello,
Hello, everyone.
Just this morning, I had a call with the other G7 leaders to discuss the pandemic. We all remain committed to doing whatever it takes to help people and our economies rebound after this crisis. We're working together to support international efforts to develop a vaccine, expand treatment, expand testing, and ensure that critical medical supplies get to the front lines. As I've said before, this is a global crisis, and it demands a global response. While we're doing everything to keep people safe in our respective countries, we also have to help more vulnerable nations fight this virus by providing more support for their healthcare systems, debt relief, and other forms of assistance. We will keep working together as partners to ensure the safety and health of people around the world.
Over the last few weeks, our government presented a series of measures to help people go through these difficult times due to this pandemic. With the emergency wage subsidy, we allow more people to continue receiving wages, although the company for which they work had to slow down or stop its activities. With the Canada Emergency Response Benefit, we give $2,000 a month to people who can't earn a living due to the COVID virus. And yesterday we announced that we would loosen the eligibility criteria to allow more people to get the assistance they need. If you are a seasonal worker, if you earn less than $1,000 a month, or if you recently run out of employment insurance benefits, this emergency benefit will be there for you. At the same time, we work with the provinces and territories to increase wages for essential workers who earn less than $2,500 a month. Auxiliary nurses, elderly care workers, all those who work hard to keep things normal are making extraordinary efforts, even if the conditions are more and more difficult. They deserve not only our gratitude, but our support. And tonight, I will be speaking about this with my colleagues from provinces and territories during our weekly meeting. We will also discuss how we can better protect our elders who are in these homes or long-term care facilities. Last night, the Bill Blair, Public Safety Minister, received an official request for assistance from the Quebec government to give help to the healthcare workers. We are working closely with Quebec to finalize this assistance program, and we will have more news to give you very soon. But I can tell you that we will give them all possible assistance, looking through the Canadian Red Cross, the Canadian Armed Forces, and specialized volunteers who registered with Health Canada. We will always be there for Canadians facing difficulties. Another challenge that often comes up during this meeting with premiers is the supply for medical equipment. I can confirm this morning that the government finalized contracts with several Canadian companies, such as Geometric Energy Corporation from Calgary, which will give thousands of gloves to our healthcare workers. Later today, Minister Anand will give an update about the latest development on these supplies.
Over the past few weeks, we've rolled out a series of measures to get people the help they need as quickly as possible. As things evolve, we're hearing from Canadians who need more help, from businesses who need more support. No one should feel as if they're alone in this fight. Our government is here to help you through these challenging times. So when we hear the program is not reaching as many people as it should, we make changes. A few weeks ago, we launched the Canada Emergency Business Account to help small businesses struggling with cash flow. Under this program, banks are offering $40,000 loans, which are guaranteed by the government. To date, more than 195,000 loans have been approved. We're talking about more than $7.5 billion in credit to small and medium-sized businesses. It's a start, but Minister Ng and others have heard from business owners who could really use this help, but who do not fit the current admissibility criteria. So we're going to make some adjustments because we want to be there to support you. Today, we are expanding the Canada Emergency Business Account by both increasing and decreasing the eligibility threshold. Now, businesses who spend between $20,000, who spent between $20,000 and $1.5 million in total payroll in 2019 will be eligible to receive a loan through the CEBA. That's businesses who spent between $20,000 and $1.5 million in total payroll in 2019 who will now be eligible. This is money entrepreneurs and employers can use to cover operational costs and help with other immediate needs. Businesses and commercial property owners are also facing specific challenges because of COVID-19, so we plan on introducing the Canada Emergency Commercial Rent Assistance. This program will provide support to help small businesses with their rent for the months of April, May, and June. To implement this program, we have to work with the provinces and territories as they govern rental relationships, and we hope to have more details to share very soon.
Several weeks ago, we started the Canada Emergency Business Loan, and this program allows banks to give up to $40,000 to eligible businesses to help them with liquidities. Up until now, more than 195,000 loans have been approved. This is $7.5 billion in credit for small and medium-sized businesses. It is a beginning. Minister Ng and others have spoken to several employers who need this help, but who are presently not admissible under the program right now. So today, we are enlarging the range by increasing the thresholds for admissibility. Now, businesses that have spent anywhere between $20,000 and $1.5 million in payroll costs will be able to make a request for a guaranteed loan. This is the kind of financings that entrepreneurs and employers will be able to use to fix their liquidity problems as well as other expenses. Moreover, business owners of commercial business lenders will be able to be helped with the commercial program in order to help small and medium-sized businesses with their rents for May and June. And in order to set up this program, we have to collaborate with territories and provinces because they deal with everything that has to do with rents. And we'll have more details about that soon.
Used to this new normal. It's been snowing in some places this week, including here in Ottawa, because that's just what 2020 brings. But we hope that the weather will get nicer. As time goes on, staying home and not seeing friends is going to be even more difficult. We're going to miss our colleagues, our friends, our neighbors, and our parents even more than we do now. But we have to be disciplined. We must stay the course. We cannot let the progress we've made go to waste. And above all, we cannot put lives at risk. So let's keep following public health recommendations. Wash your hands. Stay home as much as possible. And if you do go out, be sure to stay at least 2 meters away from others. If we persist and persevere, I know that we will prevail. Once again, thank you all for joining us. I'm now happy to take questions.
Thank you, Prime Minister. We'll now go to the phone lines for some questions. Just one question, one follow-up. Operator.
Thank you. Merci. The first question, la première question, l'inaudible, la presse canadienne. À vous.
Oui, bonjour, Monsieur Trudeau.
Hello, Mr. Trudeau. About this help that Quebec has asked you for, and you said there'll be details later, but you said that you were going to examine the question of the Red Cross, the Army, and volunteers. Has it already been decided that they will be helping? Quebec has already asked for twice for help, and we have been able to fulfill that need very quickly, like the Canadian Rangers that went to the Lower North Shore and Nunavik. Yesterday, we received a third request that we are examining because it's a little bit different than what has been asked the Army to do in the past. So we are now examining with them the best way to help Quebec in these difficult times. I acknowledge to what extent people are worried for their parents and for the seniors who are in nursing homes or in long-term care facilities. We understand that we must find ways to help even more, and we will be there to help, but we will need to undertake more conversations with Quebec to figure out exactly how we can help and respond to this unusual request, because this is a very unusual situation. Question. So what is unusual about this request? Is it because it's for long-term care facilities specifically? What's strange about it? Answer. Well, it is because it is requesting medical help, trained personnel, and our forces certainly have doctors, but not that many, and we're trying to figure out exactly how we can help out, and these are the discussions that we are having with them. As armed forces are used to helping with things like flooding, and they are trained to help in all kinds of situations of the kind. This is a new situation, so we are speaking with Quebec in order to figure out how best to help, but certainly we are there to help. We understand to what extent this is important. Thank you very much. Next question. Next question, Émilie Bergeron from the Échange Commis. Yes, hello, Mr. Trudeau. Could you give us some more specifications about the kind of help that is being requested for by Quebec? Are we talking about health that is specifically for long-term care facilities? Answer. This is a request that we have received yesterday. We acknowledge that we need to work with them, and we know that it is specifically, of course, for long-term care facilities and nursing homes. We are trying to figure out exactly how the federal government is best able to help, and we will be working closely with the province to help, and we know how important it is there, and we are definitely there to help. Question, follow-up. What will happen Monday? The House of Commons has been suspended until April 20th. That's next Monday. If there is no agreement with the Conservatives, what could then happen? What are you fearing could happen? Answer. There is nothing to fear. Our democracy is very healthy, and institutions must continue to operate, not in spite of the crisis, but because of the crisis. We are in talks with the opposition parties to make sure that we find the best way possible to continue the work that is done by our democratic institutions, whilst ensuring that we continue to follow the recommendations and the guidelines that are given by our healthcare professionals. We are, I think, about to conclude these discussions, and we'll have certainly more to announce in how the Parliament will be working out in the weeks to come.
Thank you. Merci. Next question, Ryan Tumulty, National Post. Line open.
Yeah, good morning, Prime Minister. I'm wondering, when you're meeting with the premiers today, are you going to discuss how to phase and reopen the economy? I'm wondering if you're at all concerned that the possibility that some provinces that are doing better may reopen before other provinces, creating a strain there.
I think one of the things we've seen across the country from leaders and from citizens is a desire to know when this is going to be over, how soon we're going to be able to start getting back to normal life. But I think everyone understands that until we have a vaccine, until we are in a place where there is proper treatment, there is a massive amount of testing, we are not going to be able to talk about getting back to normal. We will, hopefully, in the coming time, be able to loosen certain restrictions, but our health professionals and experts and all leaders understand that that has to be done at the right moment and very, very carefully. It would be absolutely disastrous for us to open up too early or too quickly and have another wave hit us that could be just as bad as this one, and find ourselves in a situation of having to go back into quarantine the way we are right now, and have everything that we've done these past weeks be for nothing. We know that there are lots of conversations to be had about how we reopen our economy, what happens in the right order, what the sequencing is, how we keep people safe, but we're a long way from having the ability to start doing that. Of course, conversations are ongoing now, but we're still many weeks away from talking about actually doing anything to reopen our economy, even with the variations across the country of the local state of the pandemic.
Follow-up, Brian?
Yeah, and then in terms of that discussion, do you envision that it will be based on metrics? Will it be based on the number of new cases, say, or some sort of metrics-based approach to making that decision, I guess?
I think looking at where we are on the curve, the number of new cases, the decline in cases will be an important piece of it. But I think what's even more important is the measures that we will have in place to be vigilant, to respond if and when there are resurgences of the virus in local pockets, in particular areas. We're going to need to be extremely vigilant, extremely prepared to respond quickly with massive testing, with contact tracing, with measures that people will be able to kick in very quickly if that comes. I don't think we can talk about reopening things until we are confident that we have exactly the plan on responding to future resurgences in place, and that's a lot of what the conversations are going on right now.
Thank you. Next question, operator.
Thank you. Merci. Next question, David Engren, Reuters. Line open.
Yeah, good morning, Prime Minister. On your G7 call, what, if anything, did other leaders say to President Trump about his decision to suspend funding for the World Health Organization?
I think we all recognize on the call how important it is to continue to coordinate and collaborate the science around the pandemic, to work on public health measures around the world, to share information around vaccine development, around treatments that can work. There is a need for international coordination, and the WHO is an important part of that collaboration and coordination. We recognize that there have been questions asked, but at the same time, it is really important that we stay coordinated as we move through this. That's certainly what Canada is going to do.
And secondly, President Trump yesterday suggested at the border with Canada that restrictions could be loosened. Are there any such plans from your point of view?
I think there was a recognition by the President, as I've highlighted many times, that the closeness, the collaboration, the friendship between Canada and the United States is quite unlike any other. And therefore, the work that we continue to do to keep our citizens safe while coordinating very carefully is unlike our approaches with other countries around the world. There's a recognition that as we move forward, there will be special thought given to this relationship. But at the same time, we know that there is a significant amount of time still before we can talk about loosening such restrictions. Okay. Nous reconnaissons que
we recognize that Canada and the United States have a very special friendship that is not like any other country in the world. We recognize that we can work together at more integrated levels than many other countries. And that is what the President underlined, and that's what I often underline as well. We will continue coordinating our efforts, collaborating, but the reality is that we are still many weeks away from being able to talk of softening these restrictions at the border or on social distancing.
Prime Minister Molly Thomas, CTV National News. You said there would be a significant amount of time, I guess, to having this border discussion. What is the danger to Canada to opening that border?
We are having ongoing discussions on border issues, on supply chains with the United States all the time. We have a integrated economic relationship and a close people-to-people friendship within our countries that allowed us to move forward on closing the borders in a way that assured essential services and supplies continue to travel. We will continue to look at ways we can move forward to help each other deal with this pandemic. We recognize that it will be time still before we can loosen those border restrictions.
What is the danger, though, Prime Minister?
We recognize that there is a need to protect our citizens, as every country is doing. Most countries around the world move forward on restricting travel, and Canada and the United States are no exception.
Sorry, in French?
Okay.
There are many countries throughout the world which have limited travel and control their borders to anyone except essential workers and essential goods, and that's what we will continue to do.
About retaliation at all from the Americans if we don't open on the timeline that they might want?
The coordination and collaboration between Canada and the United States on this issue and on all issues has been entirely exemplary. The reflection that the President shared was one of how close we are and how the status of the Canada-U.S. relationship is different than the status of relationships that we have with other countries around the world. There was a recognition that we will do things perhaps differently than other countries, but there is still a recognition that we need to continue holding that the measures that we have in place for a good while to come still.
Prime Minister Janet Silver, Global News. With people dying at group homes for disabilities and Premier Ford saying that the situation in long-term care homes should be, quote, a wake-up call for the world, what is your government planning to do to support the country's most vulnerable citizens, not only now, but in the weeks to come?
Well, tonight, I will be speaking with the premiers, and we will be talking directly about how to ensure better protection for our elders in long-term care. It is impossible to imagine the anguish families and indeed our elders are going through in this situation. There is just so much fear, so much uncertainty. We need to do a better job of being there for them. The federal government is looking at ways to support the provinces as they deal with this issue. We're discussing pay top-ups for people who work in those situations because the conditions are getting more and more difficult. There are also more regulations we can talk about bringing in to do a better job of protecting our most vulnerable. I think that's what Canadians expect. We
will tonight be discussing the importance of protecting our seniors. We recognize the vulnerability that they have in these long-term care facilities. We recognize that it is something horrific that they are currently living with, the fear, the isolation, the uncertainty. And we will and we must be there for each other. And our conversation tonight with the provinces will focus directly on how the federal level can support the provinces in their challenges and how we can support the workers in these centers and how we can better support our seniors.
Minister, you spoke a little earlier with regards to Quebec's request for military assistance. I'm just wondering, have you received a request from other premiers specifically relating to the military for help for long-term care facilities? And what sort of role do you see the military playing when it comes to long-term care facilities?
We have received 3 requests in total from Quebec, 2 for Canadian Rangers to help out in northern remote areas, both in Nunavik and in Bas-Saint-Laurent. This most recent request around help in long-term care facilities is somewhat different than the kinds of requests that the federal government usually gets around support for provinces, which is much more often around things like floods and forest fires. But we are, of course, working to help. We're working with Quebec to figure out how we can best help in this situation, because this is a situation that is unprecedented at many, many levels. And what we have continued to say is we will figure out how to help. We will be there for each other.
Good morning, Prime Minister. Selina Robinson, GCBC News. It's April 16th today, and that was the day that your federal modeling said that there would be between 500 and 700 deaths in Canada and more than 31,000 infected confirmed cases. We're at nearly double the number of deaths. So I'd like to know what went wrong with the modeling and what does this mean for Canadians?
I think people need to understand that modeling is a framework that allows us to plan for different scenarios in the future. It is not a declaration of what is going to happen, but it is a discussion of what might happen in the coming days, in the coming weeks, and allows us to plan and prepare for it. I think one of the things we've seen over the past number of weeks is a far more severe impact on seniors' residences and long-term care centres than we had certainly hoped for, or more than we feared, and therefore we need to take more measures to protect our seniors. That's what I'll be talking with the premiers about tonight. Okay. Les modèles.
These models do not tell us what will happen, but prepare us for different possibilities of what could be. And I think that something we have seen over the last few weeks is that our seniors' residences have been more severely affected than we feared, and that's why we will be tackling this question tonight with the premiers.
Is the Canadian government prepared for some frontline workers, medical workers, to die in the fight against COVID-19? And what would the government possibly be looking at to support family members and dependents left behind?
There have been far too many deaths already in Canada, and that's why we need to continue to do everything we can to slow the spread of this disease and to protect our frontline workers with PPE that we're ordering in, with support for them, for their families, as we get through this difficult time. And the most important thing is for Canadians to continue to stay home, to slow the spread of this virus, to ensure that those who go to work every day to keep the rest of us safe and to fight this virus are able to do so in safety for themselves and for their loved ones. We will continue to do everything we can to protect these heroes.
Bonjour, Monsieur Trudeau. Philippe Masson, de Radio-Canada.
Philippe Masson, Radio-Canada. I understand that you are bargaining or negotiating with Quebec, rather. We understand that, but how many people, how much medical personnel could you send? How many doctors, how many nurses, just to get an idea of what could be offered to Quebec in real terms? As I said, this is a request that's unprecedented. So we are developing different scenarios of how we can help. We will be there to help. We want to help. But exactly what it will look like, we are examining this. So you don't know if it will be 1 doctor, 50 doctors. We're discussing this with Quebec. I couldn't tell you. We're currently discussing how we will help you. We recognize that it is a very serious situation if Quebec's asking for the federal help like this, but we will be there. But precisely, we have to look into the solution together. And when would that be? Well, in the coming hours and days, we're working on this. If there's a request, it's because it's urgent. So we will do this as quickly as possible to be able to send the help.
Merci tout le monde.
Thank you, everyone.
Hello.